Hi everyone, welcome to Medical Coding Made Easy. Please subscribe my channel for more videos on CPT coding updates. So in this video, we will see about a procedure called Mohs micrographic surgery. So first we will see what is this Mohs micrographic surgery. Whenever there is a skin cancer and the doctor is planning to remove it, sometimes the doctor will prefer to go with this Mohs micrographic surgery. So what do they do in this surgery? They remove the tumor from the skin and view it under the microscope and make sure that there are no remaining cancer cells in the skin that are surrounding the tumor. So till then they will remove the tumor cells. So every time they will take out a small piece of tissue from the skin, put it under the microscope, confirm that there are no cancer cells, then only they will stop the surgery. So this surgery will be done in multiple stages. For example, tumor will be removed from the skin with margins and put under the microscope. If in the surrounding margin cancer cells are seen, again the doctor will remove some amount of tissue. So that will be the second stage. Again they will put it under the microscope. Again, if there is any cancer cell remaining, the doctor will repeat the procedure. That will be the third stage. So this surgery will be done in multiple stages. And also the tissue they take from the skin to be put under the microscope is called as a tissue block. And in every stage, according to CPT guidelines, 5 tissue blocks are allowed for this procedure. So now we will check about all the guidelines for this procedure. Yeah, first let us see what is Mohs micrographic surgery according to our CPT book. Mohs micrographic surgery is a technique for the removal of margins of complex or ill-defined skin cancer and histologic examination of 100% of the surgical margins. And this procedure requires the integration of an individual functioning in 2 separate and distinct capacities, surgeon and pathologist. If either of these responsibilities is delegated to another physician or other qualified healthcare professional who reports the services separately, these codes should not be reported. That means only one doctor who is playing the role of a surgeon and a pathologist. In that scenario only you can report these codes. Otherwise you cannot report these codes. Now let us see about the procedure. The Mohs surgeon removes the tumor tissue and maps and divides the tumor specimen into pieces, and each piece is embedded into an individual tissue block for histopathologic examination. Thus, a tissue block in Mohs surgery is defined as an individual tissue piece embedded in a mounting medium for sectioning. So now you would have understood the meaning of tissue block. Tissue block is nothing but a piece of tissue that is put in the mounting medium for sectioning. And as I told earlier, in this Mohs micrographic surgery, in every stage, the number of allowed tissue blocks should be 5. But sometimes the doctor will take more tissue blocks, but we need some additional codes to report them. Now we will move to the next guideline. If a repair is performed in addition to this Mohs micrographic surgery, you have to report a repair code or a flap code or graft code based on the repair that was done. And also, at the time of Mohs micrographic surgery, if the doctor is performing a biopsy of a suspected skin cancer, is performed on the same day as Mohs surgery because there was no pathology confirmation before, you can report a separate diagnostic skin biopsy codes in addition to Mohs micrographic surgery codes. And also, if a frozen section pathology is done, for that also you can report a separate code. And with these codes, you can give modifier 59 to say that these procedures are done as distinct and separate procedures apart from the Mohs micrographic surgery. So this guideline is very important here. If a diagnostic biopsy procedure or a frozen section pathology is done in addition to Mohs micrographic surgery, you have to report those codes with modifier 59. Now below this paragraph, there are some guidelines that are given within the bracket. First, we will see the first guideline. If additional special pathology procedures like special stains or immunostains are required, you have to report additional codes from 88311 to 88314 or 88342. So you can report them additionally if special stains are used. And also one more guideline is given there. Don't report 88314 in conjunction with 17311 to 17315 for routine frozen section stains. That means when they are using a routine stain, you don't have to report this 88314. Now check the last guideline that says that don't report 88302 to 88309 on the same specimen as a part of Mohs surgery. So this is also another important guideline. You cannot report 88302 to 309 codes with Mohs micrographic surgery codes. Yeah, now we'll move to the codes for Mohs micrographic surgery. The first code is 17311, which is used for Mohs micrographic surgery, which is done on a tumor, including removal of all gross tumor, surgical excision of tissue specimens, mapping, color coding of specimens, microscopic examination of the specimens by the surgeon, and histopathologic preparation including routine stains like hematoxylin, using and toluidine blue. And this is done in the body regions like head, neck, hands, feet, genitalia, or any location with surgery directly involving muscle, cartilage, bone, tendon, major nerves or vessels. So that is what is done in this Mohs micrographic surgery in the first code. And this code can be used for first stage up to 5 tissue blocks. That means you can use this code for the first stage and 5 tissue blocks. And if there is any additional stages that are included in the procedure, you have to use the add-on code 17312. So for each additional stage after the first stage up to 5 tissue blocks, you can use 17312. Now I'll give you one example. Now I'm going to do Mohs micrographic surgery on the head, and this surgery is done with 3 stages. And in all the 3 stages, I did only 5 tissue blocks. So now how should I report it? So the answer will be 17311, 17312 into 2, because I did this procedure in 3 stages. For the first stage, I have reported 17311, and for the second and third stages, I have to report 17312 into 2. So this is how we report these codes. Now we'll move to the second set of codes that is again used for Mohs micrographic surgery, but the anatomical region or the body part is different here. This Mohs micrographic surgery code 17313 can be used for surgery done on the trunk, arms or the legs. And for the first stage up to 3 tissue blocks, you can use 17313. And for each additional stage after the first stage up to 5 tissue blocks, you can use 17314. So now one more example. If I do Mohs micrographic surgery in the trunk, and I am doing the surgery in 2 stages, and in both the stages I am doing only 5 tissue blocks, how I will report it? I will report it as 17313, 17314. So if it is only 2 stages, you don't have to multiply the add-on code. Now a last code is there under this section. Now we will check that. The last code under this section is 17315. It is also an add-on code, but this code can be used with all of the 4 codes we discussed before. That means with 17311 to 17314, you can use this 17315. And for what purpose we use this code? This code can be used for any additional tissue block after the 5 tissue blocks, and it can be from any stage. So this is the point you have to note. This code is used for each additional tissue block after the 5 tissue blocks in any stage. So now I'll give you one example. So now I'm going to do Mohs micrographic surgery on the head. Mohs micrographic surgery on the head. And this surgery is done in 3 stages. And in the first stage, I took only 5 tissue blocks. Second stage, I took 7 tissue blocks. Third stage, I took 6 tissue blocks. So now how should I report it? Now let us check the answer. The answer will be 17311, 17312 into 2, 17315 into 3. And how did we get this answer? Let me explain it now. 17311 is used for the first stage and 5 tissue blocks. 17312 into 2 is used for the second stage and the third stage up to 5 tissue blocks. And now, how many additional extra blocks are there in this procedure? In first stage, there is no extra block. Second stage has got 2 extra blocks. Third stage has got 1 extra block. Totally, we have 3 blocks. And that is reported as 17315 into 3. Like this only you have to report. So you have to count any additional blocks in any stage apart from the normal 5 tissue blocks. If there is any other blocks in any of the stages, you have to put them under 17315. This section of codes looks little confusing, but it is actually a very simple thing if you understand this concept. Mostly we will get one question from this part in the CPC exam. Hope this video will be helpful to you all. Thank you.